I think throughout my entire life, I've had now what I know to be symptoms of hypophosphatasia. I have really, really tiny wrists, and my knees I can bend almost completely backwards, and I can actually turn my feet backwards too. I've always had teeth and gum issues, but all of those things now, reading about them online, they all start to line up. I really had no problems with that until about 2017. My old endocrinologist had retired, and I decided to let my general practitioner monitor the numbers. I was losing a lot of weight. My blood pressure was skyrocketing. I was having anxiety. She would prescribe me blood pressure medication. She gave me a prescription for Xanax, which I had never taken before. And then all of a sudden, one night in the fall of 2017, I went from one day sleeping around 7 hours to the next night, I didn't sleep at all. I didn't sleep at all that night or for several days. So I ended up in the hospital because I thought I was dying. They diagnosed me with doctor-induced hyperthyroidism and essentially, cut my Synthroid dose down significantly, told me to lose my general practitioner, which I did, and find a new endocrinologist. The doctor in the ER told me that as my levels, stabilized, I would still experience pretty bad insomnia until they got back to normal, and he gave me sleeping medication. But pretty much from that point on, I could never really get my sleep back on track. I went from doctor to doctor. I had some other issues going on during the time. I had kidney calcifications or kidney stones, so I was seeing a urologist, going to my endocrinologist. I was seeing a sleep psychologist for the insomnia, of course, a new general practitioner. Those 2 years were really almost a blur. I mean, I had such a strong support system. My husband really is our rock, and he kind of kept us going. But you do get to a certain point that you don't think you're ever going to find answers. And I definitely got there. Since 2012, every few weeks, I would get my blood drawn. And on all of my blood tests, I noticed a number that was marked as low. It was called alkaline phosphatase, or ALP. And I would ask each of my doctors what it meant. And they said, oh no, mine was marked very low. And they said, that's nothing to worry about. And so I, believed them. They were doctors and they know more than me. And I also at that point knew that Googling was not healthy, but it kept happening over and over again. I would get these low readings and I was still having issues with my insomnia. And one day I just decided I wanted to kind of chart my blood test results for my thyroid to see if there were minor changes that may have been contributing to when I was having major problems with my sleep. But I also just decided to put some other numbers that were off. By the time I was done, I think I had between 15 to 20 blood test results going all the way back to 2006. And on every single one of my blood test results, the ALP was severely low. The same time, I think it was within a day, my husband's father was diagnosed with a rare form of leukemia after essentially a blood test. It just sent kind of a light bulb off of my head. And I'm thinking, if my father-in-law was able to get diagnosed off of something that was on his blood test results, just like mine, there has to be something to it. So I finally Googled low alkaline phosphatase. So the first thing that pops up is that in and of itself in America is very rare. It typically said that someone with low alkaline phosphatase has a rare metabolic bone disorder called hypophosphatasia. And right as I started reading about it and what the symptoms were, I knew that is what I had. And I started to panic, for lack of a better word, because the things that you read on the internet for this specific disorder are very scary. I read that it was not a sporadic disease, it was genetic. And one of the telltale symptoms in children is teeth falling out for no reason as a toddler. And my daughter Claire lost several teeth when she was 1 year old, and also would break the same kind of bone in her hand repeatedly. We just would attribute it to being a kid. It's started to make me panic even more, thinking that it was a pretty big possibility that if I had this, with those symptoms, she could as well. He's like, I think that you have hypophosphatasia, but he said we need to confirm it with a genetic test, and we need to test, your children. Part of me was relieved, but then at the same time, I remember hysterically crying the entire way from Jacksonville back to Tampa, we got the test to confirm that I had it. Then we tested both of the kids, and of course Claire was confirmed as well.
I thought my whole life was turned upside down. I thought that I was going to change personality-wise. I was terrified of what my friends would think of me.
But I said, at least we're in this together, and we can help each other through it.
We're trying to find ways to support each other, but at the same time, it's hard because we don't know what it's like. I didn't have all the health issues before. I just lost a few teeth and broke a few bones.
We then started kind of a different journey as to how we would manage this disease for our family. I really didn't start researching again until after I was diagnosed. It was shifted from the internet in terms of finding information about the disease to finding the best specialists and other patients and families who were dealing with it. They have a lot of knowledge about it, but they're also wonderful because they collaborate with each other. They also collaborate with my doctors in Tampa. So what we really have to do is just manage the symptoms. Knowing that, I'm able to manage those symptoms a little bit better. It's not a big question mark in my mind as to what's causing it. I know what the cause is behind it, and that's pretty empowering. I think the thing that's, good and bad about hypophosphatasia is there's no crystal ball as to what's going to happen to me in 10 years or Claire in 10 or 15. It's just almost like you have to take it one day at a time. I wish I could go back and tell myself, you know your body best. Now I feel that I am worth a second opinion. I'm worth a third opinion. If you think something is not right and you're not feeling heard from your doctor, find a new doctor. As a patient, it's saying, you know what? I'm going to challenge that you're telling me this is okay because I am reading that it's not okay, and feeling that it's allowable for you to go and look into a little bit more.